So hi, I'm Steve Derbyshire. I'm an ENT surgeon with a special interest in head and neck cancer.
And I'm Jo Lynch. I'm a consultant clinical oncologist and I also treat people with head and neck cancer.
So in our previous video we had a brief introduction to what is head and neck cancer. Just on this video we wanted to talk a little bit more about the treatments. And I'll start that off by sort of saying, what is radiotherapy?
So radiotherapy is a type of X-ray treatment. It's a very powerful X-ray treatment. And when we treat people with head and neck cancer, it's a highly targeted and accurate treatment which is focusing on the cancer, on the area around the cancer, and also potentially on the lymph nodes which might be at risk of harbouring some microscopic cancer cells.
And is this something that takes many days, or is it a short-term treatment?
Yeah, so generally the length of treatment will depend on the type of head and neck cancer that you have, but in general I would say our treatments last between 4 and 6 weeks. Radiotherapy treatment does involve you coming up to your treatment centre every day, usually Monday to Friday. The treatment itself, however, only takes a few minutes each day.
Okay, and during that period, what sort of side effects would you expect from radiotherapy?
So in terms of side effects from radiotherapy, we divide them into short and long-term side effects. Usually the side effects only start to manifest themselves about halfway through the course of treatment. But in general, it can be quite a tough course of treatment to go through. It does make your throat and your mouth, depending on where we're treating, very sore, very painful. And that can lead to problems with swallowing. And you will be supported by a wide number of other health professionals, including dietitians and nutrition nurses, to make sure that you don't lose weight during treatment. Other side effects that people commonly experience will be a loss of taste, but this is usually expected to be temporary, and people can also experience disturbances in their salivary function, so they might notice that during treatment they have excessive saliva, but after treatment has finished then you can end up with quite a dry mouth as a long-term side effect. Other side effects also can include the skin, so unfortunately your skin can be quite sensitive to radiotherapy and it can go red and get quite sore during the treatment, but we usually help this by providing lots of creams to help.
On our previous video, one of the other treatment modalities we talked about was chemotherapy. Can you just explain a bit about what chemotherapy is?
Yeah, so chemotherapy is a drug treatment. It's usually given intravenously during the radiotherapy. It's usually given to make the radiotherapy more effective, so it's thought to sensitise cancer cells to the effects of radiotherapy. It's usually given on a number of different occasions during the radiotherapy treatment, and your doctor will discuss this with you in more detail. But essentially chemotherapy goes through the blood system and it goes all over your body, and it can have different side effects to the radiotherapy. In particular, it can affect your immune system, so you have to be very careful to keep a close eye on your temperature during treatment, and if you start to notice your temperature goes up, then you should usually attend your local hospital to be assessed. But other side effects, common side effects of chemotherapy can include nausea or feeling sick, and we usually give you lots of medication to try and help prevent this. It can make you feel quite tired, and sometimes it can give you some problems with your hearing or some tingling sensations in your hands and feet.
Very good. Thanks very much.